Hi class, this is Dr. Heather Austin Robillard, and this lecture is going to be Diversity Issues in Substance Abuse Evaluations. Again, we will learn about what tasks, knowledge, and skills will be represented in this lecture video. First, we want you to understand how culture affects communication and how assessing verbal and nonverbal behavior will be important for when you're working with clients for a substance abuse evaluation. We want to understand the role that the client's culture, demographics, and cognitive functioning can impact an assessment process, as well as understand the information resources regarding cultures, sexual orientation, gender, and special needs that are available for when you're interviewing individuals of a different culture. So first, you may be wondering, why should we even care about diversity issues? The substance abuse evaluation process and the instruments that we use, like screening and assessment tools, were typically developed using a majority culture as the norm. So if we ignore diversity issues, this could lead to bias in the problem formulation and information collection and interpretation. For example, we may use eye contact or see the world in a certain way or understand autonomy and family values that are specific for a majority culture and not take into consideration other cultures who may not have similar views on addiction, eye contact, autonomy, or family values. Another thing that's common among using tools and assessments is different language mistranslation as well as cultural translation. For example, craving may be considered different in certain cultures, or even other terms like blacking out may not be transferable among different cultures. While it is virtually impossible to cover each and every culture in just one class, it is our ethical obligation to continuously educate ourselves about the diversity issues of each specific cultural group without falling into the trap of stereotyping. Today, we're going to talk about the broad principles and ideas that may be relevant across different diversity spectrums. These are different sources of client cultural diversity and identity that we will try to address. One is age and generation, development and psychological disability, disability for physical disabilities, different religions and spiritual orientations, ethnicity, socioeconomic status, sexual orientation, indigenous heritage, nation of origin, and gender. In substance use evaluations or substance use disorders, there are other important groups that we need to focus on, and this includes veteran status, HIV status or diagnoses, as well as homelessness. Another important term to recognize is intersectionality. These tend to further complicate matters. For example, let's say the first client we work with is a Filipino male who is 50 years old, wealthy doctor, Catholic, living in San Francisco. We may be working with different issues and complexities with this specific person, but then let's say we add to this person as a Filipino trans female, 27 years old, undocumented, and living in rural Appalachian. Or we have an intersectionality of a Filipino female, 40 years old, recently immigrated on a spousal visa. And then we also have intersectionality with a Filipino female, 15 years old, recently immigrated and practicing Muslim. Remember, there's different issues that can come along with this. For example, an undocumented individual may be worried about what information they reveal to you and it getting them sent back to their national origin. Or, for example, somebody who's Muslim may feel that addiction is related to a spiritual malady rather than something of a disease. So if all of these individuals were referred to you for possible alcohol use disorder, thinking about which one would be the most difficult to work with, or which one do you have the least amount of knowledge in, or which one do you feel like may have certain intricacies that you have to work with in that population. When it comes to thinking about being culturally sensitive to individuals, here are a few terms we want you to know. Cultural competency is a set of congruent behaviors, attitudes, and policies that all come together in a system, agency, or among a professional organization that enables them to work effectively across cultures. Culturally responsive services, they respond to unique cultural needs of a bicultural, bilingual, or culturally distinct population. As you can see with this continuum, we have two extremes. We have stereotyping, which is inserting a specific character of a cultural group, like she's a woman, so she's so emotional. And then we have culturally insensitive, where we're saying that everybody's exactly the same and should be treated exactly the same. The different is culturally competent. We want to recognize individuals' differences and treat them in a way that is respectful to their culture. So, how do we do this? The first step is having cultural self awareness. We need to acknowledge that you yourself are products of your own diversity constellation. This impacts how you see and how you think about the world. Your cultural glasses influence how you think about your client and automatically reduces your objectivity with them. Again, we don't want to get rid of your culture or whatever objectivity you might have. We want you to recognize and see how these things may not be shared by everyone. 2 is knowledge of diverse cultures. Can you educate yourself? Yes, but it is virtually impossible to be an expert on each and every culture that is existing. A tip is to involve your client in the assessment process. Have them guide you in their worldview. Remember that intersectionality plus their heterogeneity, which means similar or sameness, within their diversity, by avoiding risk of stereotyping. Step 3 is developing culturally appropriate skills. Techniques that you choose should be in harmony with the client's way of life, beliefs, and interactions. This develops from the first 2 steps we just discussed with time, practice, patience, openness, and interaction and learning. In your first required reading, titled Improving Your Cultural Competency, on page 48, you will see this graph of how you can improve your cultural knowledge. So some of the examples include how are illness and healing practices defined and conceptualized in their culture? What behaviors, practices, or customs do members of this culture consider to be preventative? Where do people of this cultural group typically seek help? Is it customary for family members to withhold prognosis from the client? These are all questions you can ask the client or consider finding knowledge yourself when working with a new diverse client population, which will help you collaborate with them and be competent of their culture while working with them and not automatically being biased to your diverse culture. Another thing to consider are levels of acculturation. Acculturation is when somebody's family comes from another culture and they have started to acculturate or become more like the dominant culture that they live in. For example, if somebody has immigrated from, let's say, Mexico, they will start to acculturate to the dominant culture of the United States. Now, depending on that level of acculturation, gives us certain things. So, for example, they can integrate or become bicultural. So they're using both of the dominant culture and the culture that they've come from. Or they can reject the dominant culture and have a separation of enculturation. So they're focused primarily on their culture and rejecting the dominant culture that they live among. They can reject the dominant culture as well as their culture, and then they start to experience marginalization. And then if they start to accept the dominant culture and reject their original culture, they start to get assimilation. Clients can vary in their level of acculturation, and acculturation stress can be a common symptom for developing a substance use disorder. So, when we're defining the problem, diversity and culture can influence how that problem is perceived. And so, it's important to ask your client questions to see how their problem is perceived within their culture. Here's a helpful graph of how you could look at somebody's culture when it comes to their substance use and assessment for treatment. Identifying what is unique for risk factors for substance use, as well as what are the barriers for treatment in this population. What are the protective factors in this culture, as well as the drivers that drive them towards assessment and treatment? That which is accepted and familiar allows them to look at the lens that they view things, and you can use that as leverage in your assessment and treatment. Make sure you're being cautious of not being overly cultural with them. We want to provide an attitude of genuine curiosity and benevolent naivety. In conclusive, we want to look forward using screeners and test results. Note that for the most part, scores and interpretations are based off of norms of the majority culture. Make sure to interpret scores with the context of the client's culture, acculturation, and language. If available, use tests that are normed or evaluated in the respective cultural group that you're working with. This is the end of this lecture, and I hope you have learned a lot about diversity and assessment. Please make sure you read over the assigned readings for improving your cultural competency.